Thank you very much, Pamela. And thank you all for being here. There's few things that stand between myself and dinner with my kids, but the opportunity to speak to women about important health issues is absolutely one of those issues that I would move a mountain for. So grateful to Dr. McMaster and the team at VCHRI for pulling this event together. So no doubt we live in a sex-saturated society. Turn on Netflix and you'd be hard-pressed to find any show that doesn't contain either some direct or indirect reference to sexuality, with apps like Tinder and Grindr and Plenty of Fish, with many media messages suggesting that women can have sex when, where, how, and with whom they want. It leaves many of us with the conclusion that perhaps everyone is having fantastic and mind-blowing and satisfying and consensual sex. But if this year was any indication, with the Me Too campaign and all of the associated discourse around sexuality, what we know is that actually sexual concerns are very, very prevalent. So there have been a number of large population-based studies that have essentially asked that question. How common is low desire for you over the past year? How often do you experience pain with sexual activity? How difficult is it for you to reach an orgasm that's satisfying for you? How hard is it to lubricate in the way that is satisfying for you? And the large studies tend to converge on the numbers that are shown on the screen here. So women across ages, across reproductive stages, premenopausal, perimenopausal, postmenopausal women, the data seem to land on this number that around half of women over the course of a year will report a sexual concern that lasts at least 3 months or more. When you look at the prevalence of women having more than one concern, so perhaps a loss of interest in sex, as well as, say, having pain with sexual activity, you can see that about 1 in 4 women have that ongoing concern. The numbers are also very high in men, although slightly less prevalent in men than they are in women. And in our quick fix culture, there's been a lot of appeal around finding the single panacea, the little pink magic bullet to cure these sexual concerns in women. When Viagra was approved in 1998 in the United States for the treatment of erection difficulties in men, within the first 2 weeks there were 9 million prescriptions that were written. So there was a lot of interest around finding a woman-comparable product to treat these even more common sexual difficulties in women. Well, after a very long race that's lasted about 20 years and many billions of dollars, guess what? We finally have one. So Addyi, which is the flibanserin, which goes by the name Addyi, was approved in the United States about 3 years ago now. It was very recently approved in Canada, although it's not yet available in Canada, as the different provincial systems are trying to figure out how they're going to regulate this. So Addyi works by consuming it daily. It works on the brain to regulate some of the different neurotransmitter systems, the serotonin system, which is involved in mood, the dopamine system, which is involved in reward and expectations, and the neuroepinephrine system. Now, the research on Addyi, despite a lot of excitement that led up to its approval, again, given the blockbuster success with Viagra, it found that within the first few weeks, whereas around 9 million prescriptions were written for men, only a few hundred were written for women. So why was that? Well, these are some of the associated facts that go along with the use of Addyi. So in the United States, it's not covered under any state plan, and it costs women on average $800 a month. It's a medication that needs to be consumed daily, and the clinical trials showed that women needed to be taking this pill for at least 8 weeks every day before they started to have an improvement in their sexual desire. The women who participated in the studies were all premenopausal. They were very healthy. They were not taking any other co-occurring medication. They were not using a hormonal contraceptive. And the women were already sexually active. In fact, on average, about 3 sexual encounters per month. Now, this does not represent the women that I see in my clinical practice, who will often come in and say, Dr. Brotto, I haven't had sexual encounters for the past year, or maybe the past 5 years, or it's been 8 years since my partner and I have engaged in any kind of sexual activity. And in fact, I don't undress in front of them anymore. And I avoid going on vacation because there's an expectation that we'll engage in sex, and my friends will ask about it when I come back. So the reality is, with the medication, is that there are a number of side effects that have made the uptake of this medication very, very low. The kicker, if that weren't enough, is that it's completely contraindicated with alcohol. Some women have been known to say that alcohol as a social lubricant sometimes helps with sexual encounters, moving women into the mood sometimes. So the fact that Addyi is completely contraindicated and in fact dangerous when mixed with alcohol probably explains why the uptake in the United States has been so low. So in reality, this is no surprise to those of us in the field, clinicians and researchers working, doing research on sexual health concerns in women and meeting women in our offices and hearing their stories. And the reality is that for many women who have sexual concerns, they often co-occur with other issues, often psychological issues. Perhaps the woman has had a history of depression, and might still have ongoing symptoms of low mood or lack of energy or difficulty sleeping. Maybe she's experiencing anxiety on a chronic level to the point where she's having panic attacks, which are managed by a medication. Or maybe she's a woman that has a significant amount of stress from the daily grind, the never-ending to-do lists. And in fact, there's research that shows that the impact of the daily grind, the never-ending to-do list, can be more detrimental to women's sexual function than a single traumatic event that can lead to PTSD. I'll just pause and let that sort of sink in, because that's the reality of many of our lives, is the sort of go, go, go without any time for pause. So I'd invite you to think back, if you can, perhaps to a sexual encounter or a time in your life where you would describe the encounter as memorable. So maybe it was a time when you felt very in sync with a partner. Maybe it was a time where you felt that your desires were validated. Maybe it was a time where you experienced a mind-blowing orgasm from head to toe on your own. The specifics of the situation really don't matter, but there's one common thread across these encounters, and that is women describe that in each of these memorable events, they were fully there. They were fully present. They weren't noticing the beeping phones. They weren't thinking about bringing their kid to their soccer game. They certainly weren't thinking about what to make for dinner or the talk they had to give the next day. They were fully in the here and now. And so I've been largely preoccupied with this, what I've come to learn in my research and in using mindfulness with women. This is probably the single most powerful panacea that we have on hand for addressing sexual concerns in women. And so what do we mean by mindfulness? And I probably don't need to define it to this audience. Mindfulness has gained a fair bit of recognition over the last 10 or so years, although it's really been over the last 40 years that mindfulness has made its way into Western medicine and Western healthcare. And essentially we define it as non-judgmental awareness, where every thought, feeling, or sensation that arises within your attention is acknowledged and accepted as it is. So it's a way of paying attention, but it's more than just paying attention. It's how we pay attention. It's paying attention on purpose, and it's paying attention in a non-judgmental way. So I'll give you an example. If you're following along with what I'm saying right now, but there's a very good chance that most of you over the last 5 minutes have had another thought. what on earth is she saying? Where is this going? What's happening tonight? How is this relevant? Oh my gosh, this is relevant. It's that ability to notice when the mind takes off and gently tug it back and bring it back into the present moment. So it's far more than just cultivating attention. It's about doing so in a way where you're very compassionate to yourself. So what do we know about mindfulness? Well, starting in about 2003, when I was a postdoctoral fellow at the University of Washington and doing research with cancer survivors, many of whom, after their radical hysterectomies, described a complete disconnection with their bodies. They described no longer feeling any degree of pleasure while they were engaging in sexual activity. In fact, many of the women described it as though when my partner touches these parts of my body that were previously positive, it feels like they're just touching my elbow. I feel that there's touch, but there's no association to pleasure whatsoever. So this was the first group of women that they allowed me to teach them how to bring mindfulness into their lives and into their sexual encounters. And what those women taught me was that they could feel again, that those feelings could reconnect them to their sense of self and their sense of well-being. And women who were previously convinced that there was no sensation whatsoever were suddenly feeling sensations in a way that was even stronger than it was before their radical hysterectomy. So with those findings, and then beginning my appointment at UBC, we then broadened our sample to include women who were seeking treatment for the most common sexual concern, which is lack of desire, no longer being interested in sex. And so for these women who believed that the flame of their wanting was gone, that the only way to rekindle desire again was to relive those instances of their first relationship. And what those women learned with mindfulness was that they could cultivate desire again, that by paying attention, by noticing sensations, by noticing the triggers of their desire, that their desire could actually be stronger than it was before when they relied on an automatic sexual response. We also learned that my graphic didn't show up, but we also learned that for women who have a history of sexual abuse, who now found themselves in a consensual, in a happy sexual relationship and who wanted to engage in sexual activity, yet in spite of that consent, they were being re-traumatized, having memories of their traumatic past resurface during sexual activity, and who were having flashbacks and nightmares. Mindfulness was a way of keeping those women in the here and now and preventing them from going back into their horrific past. And finally, the group that we've worked with most recently are the approximately 20% of women who experience chronic burning, cutting, searing pain with any kind of contact to the vulva or vagina. Women who can't wear tight jeans because the seam produces such pain. Women who have difficulty riding a bike because of the excruciating pain. And mindfulness was a tool for them to use to ride out the distress, and in so doing, over time, their actual pain intensity decreased. And that was not a finding that we were expecting. What we were expecting was that we were giving women a tool to cope with the anxiety and the sadness and the loss around their pain, but it did so much more than that. So how exactly does it work? And this is the most common question that women ask me. How on earth does paying attention to my breath, paying attention to the feelings in my body, how does that translate into improving desire, into reducing pain, into putting me into touch with my body again? The answer is we really don't know, but this has been the focus of our research more recently. There's been some evidence that mindfulness does improve mood. In fact, there's been a lot of evidence that mindfulness can not only improve mood, it can prevent a relapse in depression in people who have a history of even repeated depressive episodes. And because low desire often co-occurs with depression, this is probably one of the mechanisms that it serves to increase desire. We also know that women who have sexual concerns are especially judgmental of themselves, of their bodies, of their feelings, of their selves. And mindfulness is one way of teaching them to be kinder. And we found in our research that in decreasing those negative self-talk, that's probably one of the ways that it serves to improve sexual function. How many of you can relate to this? Mindfulness reduces distractibility, and the reality is that distractibility and pulled into a multitude of direction doesn't stop during sexual activity. But mindfulness is probably a very effective tool of redirecting the mind so that women can remain right there. We also have evidence that mindfulness reduces stress, not only self-reports of stress, I feel so stressed, but what the body is doing during stress. So mindfulness actually regulates our natural and normal and healthy cortisol rhythm, which is supposed to start high in the morning and then decrease over the course of the day. But when we're in a state of chronic stress, our regulation goes awry and we don't have that nice drop in cortisol. So what we've found through our research is that mindfulness helps regulate the stress response, and that probably helps with sexual function as well. And finally, and this is probably not surprising, mindfulness allows us to be more in tune with what's happening in our body. There are some people who are very in tune with subtle changes in heart rate, in blood pressure. There are some women who actually feel when they ovulate. And then there's a whole lot of us who have no clue what's going on inside our body. So mindfulness training actually allows us to tune into those sensations within our body in a way that probably translates to improving sexual function. So my hope over the course of this talk is that you've learned something new about mindfulness. I begrudgingly wrote a book on the topic because I learned that the only way to get scientific findings out to the public was not to just write them in medical journals, but to actually talk to the public. And my hope for you is that this practice of paying attention non-judgmentally in the present moment, moment by moment, is the key to not only mind-knowing sex, but mind-blowing sex. Thank you.